I think I want to start just describing that I've lived this nightmare. As a practicing physician for 25 years, running a private OBGYN practice, and then additionally as running a private hospital as well. That this issue of prior authorization is the #1 administrative burden for physicians, but it's also disruptive to the hospital. And Mr. Chairman, you understated the problem. It's hard to imagine that as senators, but we've understated the particular problem. Let me just tell a quick story. Running our hospital, had a horrible ice storm on a Wednesday night. Thursday morning, the hospital is booked for surgeries. Orthopedic surgery already starting at 7:30, and they're going to go till 10 o'clock at night. The other ORs are full. We have a finite number of surgeons, anesthesia, and nursing staff. We had 7 or 8 admissions overnight, people falling, breaking their wrist, breaking their hip. So I give authority to, we're going to bring everybody in at 5:30 in the morning, start the cases at 5:30. 90-year-old lady fell and broke her hip, which is a critical, life-threatening thing to a 90-year-old lady. And you get everybody there, and then the administrator comes and says, oh, we can't do this case. How come? Well, we don't have prior authorization yet. That story is told over and over that insurance companies are now using this to ration care. It's delaying care and purposefully delaying care, hoping, I guess, that they die before they do the surgery. But there's good news. We're going to reintroduce our prior authorization bill, Seniors Timely Access to Care Act, this June. And this is the solution. So we know the solution. Now we need Congress to move forward. What this bill does, among other things, is set guardrails, streamlines, and standardizes the process for prior authorization. It is this prior authorization reporting requirement in our bill is the RX to cut down waste, fraud, and abuse. We've got the solution. 53 Senate co-sponsors, 10 senators on this committee, including the chairman, are co-sponsors of this legislation that we're reintroducing in June, if I didn't get that message right. We have 326 House members. We have 550 outside organizations. We've now got a 0 CBO score. So I speak to the minority and the majority staff that we now have a 0 CBO score on it, and there shouldn't be any reason that everybody on budget, on health, and finance committee shouldn't co-sponsor this bill and be passed with unanimous consent. I appreciate the chairman continuing to highlight this situation. Now here's the bad news. Is our bill only addresses Medicare. We need to go into the private practice as well. Certainly what we're seeing back home is Medicare Advantage. Started off as a great thing, kind of a value-based theme, but now it's being abused. Imagine that. That we're having horrible products sold out there, and for a giveaway for a toaster, you too can have a cheap Medicare Advantage solution as well. I don't know that I got a lot of questions for our witnesses. I'm very grateful. I appreciate your testimony. I've lived the same nightmare that you are living, but maybe Mr. Benedict, Dr. Benedict, just speak a little bit about the Medicare group versus what you're seeing in the private sector, perhaps.
Lack of standardization, it varies across the board depending upon who you're dealing with. Product design, prior auth denials, policies and processes that are different from payer to payer. So it's very difficult to traverse your way through. We provide scaffolding around our providers to help them, to relieve them from that burden. And it's even difficult for us who know what I consider to be the game around not getting timely responses back and holding back really what's important care that's necessary to the patient at a time in which it's most important.
Yeah, Dr. Cutler, are you seeing, this Medicare is a problem, Medicare Advantage, but it's also in the private sector, obviously.
Private sector, it's Medicare Advantage, commercial insurance, and Medicaid are the biggest ones where you see it.
Yeah. Dr. DeGiorgio, anything to add? I think we beat the horse pretty good here, but.
Yeah, I totally agree. My wife's also an OBGYN, so I think she feels the pressure as well as me. I think to the administrative burden side, when my 4-year-old daughter says she's playing doctor, and that means she takes out her toy laptop and starts typing on it.
Oh my
because
gosh.
She sees my wife and I come home and just spend, our waking
I'm so
hours
sad
at
to
home.
Hear that.
Yeah, on our
But this is why none of my kids went into medicine. My wife a nurse, I'm a doctor, 4 kids, 0 going to healthcare. It's because we were so, the administrative burden is the start of the tip of the iceberg, let alone a nurse who hasn't seen a patient for 10 years telling me I shouldn't do a hysterectomy. It's very frustrating. Thank you, Mr. Chairman.